Hey, welcome. Dr. John Lee here with the Alpha Omega Biz Dev podcast, where I teach business tips and strategies for small businesses in particular, but even more niche into chiropractic business owners. So if that's you, you are in the right place. And today you're in for a good one. So this is a topic that is a common issue for my fellow chiropractors in business for themselves. And that is the question of, are you tired of convincing patients into care? Meaning when you meet new patients and they come to you for help and you assess them, give them your best recommendations and outline a treatment plan and tell them what the costs are, that too many of them are saying no. And it puts you in a position of feeling like you're constantly having to convince people. Okay, so that's a topic that we're going to dive into on this podcast because it is, again, such a common issue and trouble point for chiropractors. And that was me as well. That was my early years as a chiropractor. I did struggle, like most chiropractors, with presenting treatment plans and getting acceptance at a high rate and high percentage. So let's talk about first the issue at hand. Okay, so if you are a chiropractor, and it may not be you, but because this is such a common widespread problem amongst chiropractic business owners, even chiropractors who are, say, an independent contractor or an associate in an office, a very common trouble point or issue that we have as chiropractors is getting the general public, new patients that come to us with a problem, an issue that they want resolved, getting them to willingly and at a high percentage rate say yes or accept our treatment care recommendations. And so there's different terms for this. You can call this new patient conversion, new patient close rate, close percentage, all kind of referring to the same thing. Basically, is a patient agreeing to your doctor's recommendations on what they need, and also they're okay with the financial commitment to that, because obviously, it does take money and maybe some insurance involvement for them to get the treatment that they need. Okay, a good close percentage or a conversion rate in our chiropractic industry, I would say, is 80, 85, 90, 95% or more. Okay, I think really the gold standard is 90% or higher. If your percentage is lower than, say, 70%, say you're 65, 60, 55, 50%, then what it means is that, a big chunk, a large percentage of your clients that come to you for help are just not, seeing eye to eye with you, and they're choosing not to go forward with you past the first or second visit. So why is this such a problem? Okay. Let me talk about the relation and how chiropractic is perceived in our society and our public compared to, say, medical care and dental care. Okay. So medical care and dental care, because both have been around for hundreds and hundreds of years, it is very widely and easily accepted by the general public. So most people out there know that, hey, you should have a general primary care physician, a GP, general practitioner. Basically a medical doctor who you can go see for health issues, ailments, to run annual blood work for you, to go see for annual physicals. Most people do have one of those. Most people also understand you have to have a dentist. And we see dentists from when we're young and we have teeth, and we see them for our whole lives. We see them for cleanings once or twice a year, regular x-rays to look for cavities and issues. And we typically understand we're going to see a dentist for our whole life. Okay. Now, when it comes to chiropractic care and your spine, right? And yes, you have a spine. Even if you're not a chiropractor watching this, everybody has a spine. You can feel it on your back of your neck right now. And although everyone has a spine, just like everyone has teeth that need a dentist, everyone has just an overall body that may need a medical doctor, we all have spines that need a chiropractor or a spine specialist, but our general society has not fully adopted that as a norm yet. And there's, a couple reasons to that. One is that chiropractic came in kind of late into the game when you're going to compare to dental care and medical care. So it wasn't until 1895 that chiropractic was actually founded by D.D. Palmer, our founder of chiropractic. And then it took a long time before it was actually really accepted. And it was really challenged for many, many decades. If you know the backstory, D.D. Palmer's son, B.J. Palmer, is one that really developed chiropractic. Over many years, he really got the message out there to the world of what chiropractic was, and he did a great job. But it wasn't until the 1970s and 80s that chiropractic was really accepted, and that was because of a very famous Supreme Court case where the AMA, or American Medical Association, was actually found guilty of trying to sabotage the chiropractic profession. So it was the Wilkes case. You can look this up and find the details on Google on this. But once the AMA lost and was found guilty of trying to sabotage our beloved chiropractic profession, then chiropractic finally started to flourish in the 80s, 1980s and 90s and so on. So if you think about it, chiropractic hasn't even really had a chance to flourish until the 1980s, which I was born in the 70s. I don't want to age myself, but it was in my early years that chiropractic finally started to become more accepted around the world. But it's still a far ways to go compared to medical and dental. So the point being is that most people, when they go to a medical doctor is presented with the issue. They say, hey, here are my recommendations, this and this. Most people will say, yes, doctor, sure, whatever you say. I'll say, not everything you want to say yes to, but for the most part, most people trust their medical doctor and will follow the recommendations. Same thing with dental issues and care. So if you have a toothache or your dentist says, hey, you've got a cavity back there, hey, let's go ahead and get that thing taken care of, right? And there's really not a lot of objection to that. With chiropractic, because there still isn't a full understanding of how chiropractic works and how chiropractic should be used in everyday and regular life, there is a little bit more resistance. So in our profession, we have had chiropractic, coaches and consultants, and I am one as well, that have really stressed the point of education, that you have to teach your patients about the spine and the benefits of chiropractic and the dangers of what we call subluxations or misaligned vertebrae not being detected and treated, that you need to do a lot of that, okay? And then the patients will understand what they need and they'll accept your care, okay? And a lot of that was actually coming from what I also was taught back in my early career, is that you got to start on the first visit. We call it day one, okay? Problem is, if you do this with patients on day one, when they're coming in for, say, a neck pain or a back pain or pinched nerve or headaches or something spine related, and you're kind of tangenting off and want to give them an education on chiropractic philosophy, the history of chiropractic, how chiropractic is so great, there's going to be a disconnect. Okay, you really have to focus on what the patient is there for first and address that really, really well. Now let me talk about how most corrective care chiropractors go about processing or handling new patients. And so there's typically what we call a day one and a day two visit. Day one, or the new patient's first visit, is when the chiropractor sits down, meets for the first time, does a consultation, finds out what the issues are that the patient's coming for, then does a physical examination. Usually x-rays are done on site, and then that's the completion of the day one or first visit. Then most chiropractors do need some time to analyze and measure those x-rays and exam findings and come up with the best recommendations or treatment plan. And then that is presented, the report of findings is presented on the second visit or day two. So we go over x-ray results, explain what is causing their issues. We outline and present a treatment plan, which takes several months usually. And then we present the associated costs, whether insurance will help or not, what their payment options are. And so in chiropractic, there usually is a debate. What is more important, day one or day two? Okay, so let me, before I answer that and give you my professional opinion, let me have you really think about that. What is more important, If you're a chiropractor and you're seeing new patients, is it day 1 more important or is it day 2 more important? Okay. If you said day 1, I agree with you. Okay. Now, I used to think the other way. I used to think that you had to really go deep on day 2, spend extra time with them, explain x-rays fully, use spine models and just like break everything down, explain every step of the treatment process before you went over financial payment options and things like that, right? And it wasn't until about later point of my career, and I've been in practice about 22 years now, that I realized it actually all happens on day 1. Day 1 is where I feel you win that patient over. You really connect and bond, and the patient feels by the end of that first visit that you are their chiropractor of choice, that they need to look no further. If you're trying to have a brief to average day 1 visit and try to really wow them and pizzazz them on day 2, you're in an uphill climb. Okay, so I myself practice really focusing on day 1, putting a lot more emphasis on that first visit, because think about it. Put yourself in a patient's perspective. If say you're a patient, say you've never had chiropractic, say, if you're a chiropractor watching this and you're not a chiropractor, you've got a bad neck pain or a low back pain or something spine related type of condition, and you've gone to a chiropractor the first time, wouldn't you want to know on that first visit, get a good feeling or a hunch or intuition that this chiropractor is going to be able to help you, right? You wouldn't want to have to wait until the second visit to find that out, okay? So it's really important to make that first initial meeting, or that first impression, if you will, really effective. Okay, so I am going to give you some tips and strategies on how you can do this. Now, there's 4 tips. Okay, number 1 is that you want to be confident. Okay, now there is a difference between being confident and being cocky and arrogant. So what I mean is just have an air of confidence that, hey, you know what you're doing, that patient is in the right place, that you're in control of understanding what's going on and figuring out how to assess their problems, and that you're going to come up with a solution. Okay, so having confidence in that new patient appointment is the first step. Tip 2 is ask the right questions. Now, in our profession, because there have been consultants and coaches throughout the years, a lot of them teach that you ask certain questions and you move on. Okay, I recommend asking the right questions, and I call it playing detective. So say, for example, you ask them, hey, have you had any traumas or car accidents or injuries? If they say, yeah, I had a car accident 5 years ago, I was rear-ended. Don't just leave it there. You want to ask the right questions. So it would be, tell me about that. What kind of impact? Rear end, front, how much damage? Because if the patient says, my car was totaled, yes, what happened after that? I went to the hospital by ambulance, spent 3 nights there. If you don't ask the right questions, you're never going to know that, because that information is very important for you to understand that could have played a role in why their spine is the way it is today. And you can also educate your patients on how all that plays a role. Okay. You can also ask the right questions when it comes to chiropractic treatment history, because most people, I would say majority, have at least been to chiropractor at least once. You want to ask about that. Ask when they went. What was it for? What was the treatment done? When was the last time? All these things will help you understand how much chiropractic that they've had and how this is going to relate to the chiropractor they're about to receive that you're going to recommend. So it's very important to ask the right questions, dig a little deeper, play detective when it comes to chiropractic treatment history. Third tip is to be natural and matter of fact with your communication delivery. When I've helped chiropractors with this topic of improving their new patient close rate or percentage, when I get to hear some of their audio recordings of this, the issue that I commonly hear is that they don't talk natural. They don't sound normal, matter of fact. They sound very different from when they talk to me outside of their chiropractic office. And I used to make the same mistake. I used to have a certain type of doctor persona that I took on inside my office, and it was very, not me, not genuine. And when I realized that I needed to actually talk to new patients just in a normal way, as if I was talking to my cousin, my uncle that I wanted to help, that would be much more effective and much more connection would happen with that patient, because the patient is just going to organically feel that connection when you're talking like your normal self. And the fourth and the final tip is your tone should be more on the serious side. Now, I don't mean scowling and mad. What I mean is, don't crack jokes, be too jovial, spending way too much time trying to get to know the person on a friendly level. A little bit of that is okay, but you want to quickly get to the matter at hand. So if they're there for a severe 9 out of 10 pain level, low back pain and sciatica down the right leg, and they're limping and hobbling, barely sleeping, you want to get into that mode with them, right? They're there. They're not feeling good. They're probably very serious about figuring out what this issue is, and they want their doctor to be serious with them, right? So you have to usually match that tone. Now, if you get a patient across from you who is very jovial and obviously you want to laugh and kind of go along with that to some degree, but you usually want to have a very serious professional presentation about you so they know that you are taking their issue seriously and that you're going to figure it out. Now, with those 4 tips, I can definitely go deeper in this, with this and other trainings, which, we don't have time for on this podcast. But know that if you start to focus on those 4 tips, you will start to have better results on your day 1 connection with your new patients. And if at the end of that first visit, if you start getting more of that feeling from that patient that you could already tell that they're connecting with you, that they're starting to really get comfortable with you, you've got a patient that usually has already made up their mind, that you don't really need to convince them any further, especially on the day 2 visit, that they're likely going to accept your recommendations on what is the best for them to resolve their issues. Now, let me touch a little bit on the day 2 visit. Now, again, if on day 1 you've done all the heavy lifting, you just had a really great connection and communication, you performed extremely well on your day 1, and you did the best job you could with that new patient, then the day 2 visit should honestly come with ease. Time-wise, I don't recommend anything more than 15 minutes. Again, in our profession, a lot of us chiropractors who are veterans have been, coached by past chiropractic consultants to spend time with them, do 30 minutes. I remember some consulting groups would teach you to do this over multiple days and visits, that there has to be a ton of education. Again, I don't think the first 2 visits is the time or place to really teach them all about chiropractic and then history and philosophy. Yes, you can do that, but I teach my clients to do that later. You do that later in the first or second month of care in a different format. Okay, the first and second visit, it's really all about the new patient and what their needs and wants and desires are and how you can help them. So on that second visit, don't go into long, drawn out 25-minute, 30-minute report of findings time, because ask yourself this, as a patient, that you've been of other different type of doctors, when has a doctor ever spent 30 minutes with you to go over your results and findings? Okay, very rare. I don't remember ever my dentist or any medical doctors or any other types of specialists. Even when I've broken my wrist snowboarding, the ortho surgeon that was going to do surgery on me didn't spend not even 10 minutes explaining what the issue is and what had to be done. So, we as chiropractic doctors, we have to understand how to present findings and recommendations in a very concise manner. So typically 10-15 minutes is really all you need, as long as you've had that amazing day 1 interaction with that patient. Okay. So those are, my key tips for you. Again, if you do want more information on this, my coaching program goes a lot deeper into the day 1 visit protocol process, day 2 as well. Okay. But in general, put your energy, your emphasis, your time, your efforts in getting better, honestly, into day 1. Okay. Then day 2 is really just something that comes naturally and with ease, as long as you've done a great job on day 1. So if you're a chiropractic business owner, I hope that helps. And if you're a small business owner of a different type, the main takeaway could be really focus on your first interaction, right? So whether it's a sales call or sales meeting, that first interaction is usually going to really set the stage and set the tone and give that customer or buyer that comfort level of doing business with you going forward. So Dr. Lee here with this podcast. Hope that brings value to you. Check in again, hopefully next week. We're going to have another topic that will add value to your business. And until then, see you there.